when I read the lecture, I was, read the title of the lecture, I said, what does this have to do with neurointervention? What does this have to do with what I want to practice at one point in time? And you will see, hopefully, at the end of like the next hour, that it has quite a bit to do with neurointervention and with quite a few things that we are doing, and it will hopefully help you to understand better anatomy, embryology, as well as classification of vascular malformations and management of vascular malformation. Lighting the lights are dim, so for those of you who are jet lagged, now is a good time to fall asleep. So I have nothing that is relevant to disclose in relation to the contents of this presentation. This is the overview of the talk. So we'll first go through some very basic definitions. What is angiogenesis? What is vasculogenesis? Then we will speak more about growth factors and their roles and the different families of growth factors. Then we'll dive deeper into vasculogenesis and angiogenesis, and angiogenesis will describe both the embryonic and the post-embryonic and the pathological angiogenesis. And of course, we will need to discuss the concept of the angiogenic switch. And the majority of this talk will be then on applications of these rather esoteric concepts that we will discuss now one by one. So, first of all, what is vasculogenesis? What you have to remember is that vasculogenesis only occurs once in your lifetime, i.e. it occurs when you are in the womb of your mother and you have the constitution of endothelial cells de novo, i.e. prior to vasculogenesis there are only progenitor cells, and after vasculogenesis we have the primitive vascular network with the early endothelial cells. And then we move towards angiogenesis. Angiogenesis means formation of new blood vessels from already pre-existing ones. And it's not only formation that is like a positive formation, i.e. development of new vessels, but you can also have pruning of blood vessels, i.e. some vessels are no longer needed and will actually be removed. So angiogenesis occurs during your entire lifespan. Like even now as we are speaking, your endothelial cells will replicate and will form new cells. Whereas vasculogenesis only occurs once. During vasculogenesis, these endothelial cells differentiate and proliferate within a primary avascular tissue. They coalesce and they form a tubular network. This is this primitive vascular network that is demonstrated right here. And from this primitive vascular network, we have then the development of the aorta, the major veins, and the plexus, which will become the capillary bed in between. After the vasculogenesis, we will have an angiogenic remodeling, which means that certain vessels will be used more, certain vessels will be used less. Those that will be used more will actually enlarge, those that will be needed less will be pruned away, they will be removed. Then the vessel walls have to mature, and the maturation means that the endothelial cells have to be integrated with smooth muscle cells and pericytes, so to have your normal and mature vascular network.